I'm going to now talk to you about the pathophysiology of renal failure. According to the Huether and McCann's in our pathophysiology book, renal failure refers to a significant loss of renal function. So it means there's less than 10% renal function remains. Once that occurs, then that would be termed end-stage renal disease. Overall, renal failure has had many names: renal insufficiency, azotemia, uremia, and I'll go ahead and explain to you. There's various problems that can lead up to renal failure. Overall, acute kidney injury, so it's something that happens all of a sudden. For the most part, may occur within a couple of hours. Let's say sepsis. It can lead to acute kidney injury. And then from there, we get also renal insufficiency. So what renal insufficiency means, it's a decline, meaning your kidney is functioning at about 25% of what normal, or a GFR of 25 to 30 mLs per minute, glomerular filtration rate. Then we have uremia, which occurs, and with that comes retention of toxic waste, deficiency state occurs, electrolyte disorders, and eventually immune activation promoting a proliferatory state develops. As well as azotemia, which is characterized by increase of urea and nitrogen levels in our blood, when the normal urea nitrogen levels are 8 to 20 milligrams per deciliters. So eventually this will lead to an increased serum creatinine levels, and eventually renal insufficiency or renal failure causes that azotemia or uremia. A lot of times azotemia or uremia people say, oh, it's renal failure, but it's really a syndrome of the kidney injury. I have a table here that categorizes renal failure or renal injury. So it's based on glomerular filtration and urine output, which most of renal failure is based on that. Whether you're filtrating enough or is there any urine output occurring. So there's the risk, there's injury, there's failure, there's loss, and there eventually end-stage renal disease, which is meaning more than 3 months. I'll go from the smallest. It goes risk, so increased creatinine times 1.5, or a GFR decrease by 25%. We have urine output criteria. Urine output when it's less than 0.5 mLs per kilogram per hour for 6 hours. Now, if we go towards kidney injury, this is an increase times 2 of GFR or GFR decrease by 50%. Then we see a urine output, meaning less than 0.5 mLs again, times kilogram per hour, but this means for 12 hours. Failure, what is considered failure is an increased creatinine times 3 times, or a GFR decrease by 75%. The urine output here is going to be 0.3 mLs per kilogram per hour for 24 hours, or you will have no urine, so anuria for 12 hours. Eventually, what leads to end-stage renal disease is just this occurring for more than 12 months. A loss means it's persistent ARF, or a complete loss of renal function for 4 weeks. So that's loss. Eventually, ESKD means for more than 3 months.